You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Georgia's go-to dental implant dentist, Dr. Justin Scott. Dr. Scott, welcome to the program.
Thanks for having me.
Good. Now, I know you brought some photos, so we'll get to as many of those as possible. Now, for people that don't know about your center, and I know you do a lot of things, but a big emphasis is giving people new teeth supported by implants. Who's the typical dental implant patient?
So the majority of our dental implant patients that come in, they have bleeding gums, they maybe have loose teeth or bad breath, and they've been told that they're going to need to get dentures.
Okay.
So those type of people, we can take them and we can give them a full set of teeth that don't come in and out and as quickly as one day.
So when we say at the top of the show, no more dentures, that's real.
Absolutely.
Like you don't think anybody should be wearing dentures?
No, absolutely not. It would not be, with the technology that we have today, there's no reason why anyone would have to
get a denture.
Absolutely.
Now the second group, I'm sorry I interrupted.
Well, the second group would be people that already have dentures and then don't really know that there's options to have something that's more natural. So for those people, we can basically take their dentures, we can connect them to implants so that they're fixed and they don't come in and out and they don't move around anymore.
Now, you told me that on the day of the procedure, somebody could, like a denture wearer, could come in with no teeth, and on that one day, they can walk out with upper and lower teeth that don't come out.
Right.
Really?
Absolutely.
Okay.
So we can basically make a copy of what they have. We can use that and add the implants, and then we can digitally modify it so that it connects right to the implants that day.
Now, your center, and correct me if I'm wrong, how dental implants here in the United States is done, you go to one doctor that does the surgery, maybe an imaging center, then you go to another doctor that puts the teeth on top. You do both parts. Like you do everything right there.
Right. Most of our patients, they don't want to go to multiple offices. They want to get everything done in the convenience of their own, under one roof.
Okay.
So we're able to take them, we're able to make the teeth in the office with our dental lab, we're able to do the surgery, we're able to do all that in the same day. And we even do the maintenance and the follow-up for them as well, so they don't have to go anywhere else to have that done.
So you have a lab that literally, like you have digital printers,
3D printers
that make the teeth right there.
Right. So we have the 3D printers that make the teeth in 45 minutes. Those are more for prototyping, and then we have mills that make the permanent teeth that are strong and that are beautiful and that last a really long time. And we have our lab techs that are world class that basically help us make that whole process happen.
So because you have an in-house lab, is that why you're able to do it so quickly?
Absolutely. In the past, we would have to send it out to a lab. We'd have to wait a few weeks, and when it comes back, hopefully it works. But sometimes that didn't actually happen.
That's how it's normally done, even in Atlanta.
Absolutely. All over the country, that's how it's typically done. But the premier centers around the country are starting to bring it in-house so that we can do it more efficiently and quickly. That way we can specialize in the production from a vertically integrated perspective.
How old can you be to get this done? Like somebody watching this in their 80s, could they do this, or too old?
Oh, well, probably the majority of our patients are in their 80s. I've heard of patients that are in their hundreds that have had dental implants done.
Why would they want to get that done at that age?
Well, I mean, for anyone, until the day you die, you're going to eat 3 times a day. And if you can't enjoy that process, then your quality of life goes down. So I think it's really important at any point in life that you're able to eat and enjoy your foods, that you're able to smile for the most.
But if you're 85 years old, are they more likely to fall out and not work?
Implants?
The implants, yeah.
Oh, no, absolutely not. Obviously, the older you get, the more likely you are to have bad health, and bad health can make it more risky. But at the same time, bone is bone, and bone works as long as you have good bone. The majority of the time it works. It's 98% success rate with dental implants. And for the ones that don't work, we replace them and we get another chance at a 98% success rate.
Yeah, but isn't it true if you've been wearing a denture like 10, 15 years, you can't do this because you don't have enough bone?
What is true is that when you wear a denture for a long time, you lose bone and you have less and less. But the great thing is that technology has caught up with the science has caught up, and basically we're able to do more and more complex types of procedures to be able to get someone implants that in the past they may not have been able to do that.
So if somebody's been wearing a denture 10 years, you could work with them?
Absolutely. We'd work with people.
Is that common?
It happens every day. If you, in Atlanta, if you looked at the number of people that needed dental implants or that have dentures, literally you could fill Mercedes-Benz Stadium with amount of people that are qualified to be able to have these types.
So there's that many people wearing an upper lower denture or headed dentures.
It's incalculable.
Like tens of thousands.
The study showed that the number's growing every single year with the baby boomers and everything like that. We're starting to see it more and more, and it's a huge part of my practice now. It's pretty much what I'm specializing in at this point now. When I say specializing, I don't mean that I've done a board certification for that, like you go through in dental school, but it just means that that's what I'm limiting my practice to.
That's your focus?
Yes, sir.
Okay. So if there's so many people wearing dentures in Atlanta or throughout Georgia, why aren't they all coming in to get new teeth supported by implants? What's your take?
Well, there's several reasons why they don't. One might be that they basically, the day they got their teeth taken out was a great day because they didn't have to visit the dentist anymore. For a lot of people that are in this situation, say they have bad tooth decay, they were so tired of dealing with the aches and the pains, the hot and the cold sensitivity, the teeth breaking, the fillings, going to different specialists to have things done, having a root canal, having that break, having that fail. They're just, once they got their teeth out, they were relieved and they never want to come back and see me again after that.
Okay.
So they've been out of the system for a long time and they may not know their options.
So denture wear just doesn't even know this exists.
Exactly. So there's a lot of people, they don't even know that that's an option, or they may have heard that they're not a good candidate because they didn't have a lot of bone. And we have a lot of patients that were maybe told somewhere else that they weren't good candidates because of their lack of bone or because they've had.
But it's just not the
dentures.
case anymore because of technology?
Exactly. So there's a lot of different ways that now with our 3D scanning abilities, with the way we're able to place implants in unique places that before wasn't really common, we've come a long way. So you asked about why I think that people may not come to us. And I think that there's people that once they're in a denture, like I said, they don't want to come to see the dentist anymore. They've been through the ringer with dealing with all the different problems with their teeth, with teeth breaking, with the cost and the different things being redone. It can be really frustrating for people.
So they don't want to see you. They don't want to come in.
Right. I've had many people tell me that.
Do you still hear that? Like, no offense, doctor?
Every day.
Do you have a funny comeback after all these years?
I tell them that, dentist is not my favorite place to do. I would rather be asleep when I go to get the dental work done.
Okay, good.
So that's what brings me to my second point, which is a lot of people are afraid of the dentist.
Okay.
They have had a bad experience in the past. They don't like giving up control. They don't want someone to be in their mouths. And I can tell you all sorts of stories about patients that have told me about bad experiences they had when they were a kid. And now, they just want to avoid the dentist until things get bad enough, until something has to happen in order for them to finally come in, And I can tell you a lot of different reasons why that might be, but usually it's not their first choice. We're the last house on the block, and they show up because things got that bad.
So what's the answer for these people that are afraid of the dentist?
Well, my favorite part of being a dentist is that I get to sedate patients. We do IV sedation dentistry. It helps us do it in the most controlled and comfortable manner possible. And a lot of patients, they come in and they're in disbelief. A lot of people don't even remember.
They don't remember the
having
procedure.
Been there. Yeah.
So what, you're monitoring like what?
We're monitoring their heart rate, and most importantly, their breathing. They're making sure that they're breathing. They breathe on their own. It's not like in a hospital where you're putting a tube down someone's throat.
It's just an IV line kind of a thing.
Exactly. But I would say, what I actually say is that it's kind of like a drunken New Year's Eve.
Okay.
You kind of remember parts of it, but you don't remember the majority of it.
And you could pull them out of it?
Absolutely. Yeah, we
Also,
have medicines.
Is that why it's better than the pill? Like a pill you give somebody?
So with a pill, it takes an hour or so to kick in, and it can take, depending on the person's metabolism, an unknown amount of time to go away. So with an IV, though, we're able to basically give them just enough medication to keep them comfortable throughout the process. We don't have to guess at the amount. We're able to see the result of the medication we give instantaneously. It takes 15 seconds to go directly to your brain.
So pain is not something they really complain about?
No, we give, a lot of times we'll give them pain medication that's 100 times stronger than morphine, so it's very comfortable for them throughout the entire process.
So some people can do the after care without any medication, just like over-the-counter stuff?
You know, it's funny because you would think with a major situation where you're taking teeth out and when you're doing these major procedures that someone would have a lot. I have a lot of patients that say they don't take any medication at all. Another reason that people don't do this is because of cost. So, you know, with the technology we have today, we're able to do things much easier, much more efficiently. Okay. So we're able to do it at a better cost for people. We don't necessarily need to have an implant for every single tooth in the mouth. As minimal of 4 implants is enough
to give them a full arch of teeth.
To give a full arch of teeth. So it's a 4-legged table, basically, is what we like to say.
Yeah, but what if you have gum disease?
Right.
Can you do this, or you cannot do this if your gums are bad?
No, those are some of the majority of what our patients are. They're people that have suffered from gum disease, that have looser, wiggly teeth, and they can't chew as well anymore. So those types of people are some of the most important type of patients that we see.
So what, you just clean up the gums? Because it's a bacterial infection, right?
Absolutely. Now, it's important for people that have had gum disease that they have their maintenance, because they can still have the same problems after the fact. But we see many patients that have had gum disease, they get a fresh start. It's like building a new house. Now, a house, I always say that your dental implants will last as long as a house, okay? Now, it depends on who's living in the house and what they're doing with it.
Okay.
If they're doing their maintenance, you know, things will last a long time, but it's a fresh start.
So just like regular teeth, like every 6 months or so, you go in and get them cleaned?
Absolutely. Yeah, you have to remove the bacteria. The bacteria is what causes the problems. Removing the bacteria, your hygienist does that. That's why maintenance is so important. And that's one of the things that make our center unique, because we actually do the follow-up maintenance for a lot of these procedures. We see patients that have gone to some of these other big clinical centers that do dental implants, but they don't do follow-up. And
meaning the cleanings, the follow-up, the adjustments, things like that?
And I've also seen many of these patients that 10, 15 years later, that the implants don't last. A lot of people think that, oh, I've got my new implants and they're going to last forever. They will if you take care of them.
You just have to clean your teeth.
You have to maintain them, just like anything. Just like a house, you have to do the maintenance or it won't work. So, but for some of these people, when they get their new teeth, their new smile, they want to take care of their teeth.
Okay.
So they don't have a problem coming. They had a great experience when they had their procedure done, and they build the relationships with our staff, so they wind up being some of our favorite people to see.
So what do they like more? What they can eat and chew, or the appearance?
Well, I think for both of those things are really important. And initially someone comes in thinking one or the other. They might be thinking that I just need to eat. But they get used to it really quick, and they realize that, you know, a lot of people really love the way the smile looks after that. They love the way they feel. They love the way other people look at them. And they love all the compliments that they get from people on a daily basis. So
they can, and now what about eating? Okay, so once it's done, they're healed up. Can they eat like hard things, like a carrot with their front teeth?
Right.
Or tell me about that.
So it's funny, because one of the things I love to do is I like to take what their favorite food is into them afterwards and allow them to eat it for the first time. It's one of my favorite things. So I remember one patient, I was able to bring her peanuts and she was able to eat that. And it was like, seeing that is super fun for me, because people, they've been so long without being able to eat that. But
so you can eat like popcorn, things like that too?
You can eat popcorn, you can eat steak, you can eat peanut brittle. I don't recommend that because that can be pretty hard sometimes. That can break normal teeth. But anything you eat with normal teeth, these are like real teeth. So they're like a fresh start for you.
Are they even stronger than real teeth?
Well,
possibly.
Our natural teeth are very, very strong, but they're very competitive. Now, the only problem is that sometimes they're even harder than the materials that we have in our natural teeth. So sometimes when we do like an upper against a natural lower, they can wear out your teeth. So that's good and bad.
You said earlier that people do this on occasion, like they're getting a divorce, they're getting married, they're single again for the first time.
Usually it's some situation that happens in life that gives them the energy to make that step, to take the step to move forward. I've heard many stories about, I had one girl that it was her daughter that told her that, Mom, why are your teeth so black? You know? And when she heard that, it inspired her to come into the office. She had avoided going to the dentist for her entire life because she had a bad experience with her child, you know? She told me that her dentist held his hand over her mouth and told her to shut up when she was in the office. And, you know, I ask these questions and I try to find out what's their motivation. when we started talking to her about IV sedation, she was ecstatic. She was hooked. So, we did the procedure for her, and everything came out great. And I mean, I remember that day because she was, when we do the smile reveal at the end of the day.
Like with a mirror in front of them?
Yeah, well, at the end of the day, we'll put the teeth in, and after it's a long day. There wasn't a dry eye in the room at that point. I mean, everyone was crying, even my staff, because she was so happy, and you could tell just by her smile. We've got it on video. We got the video to prove it.
Is it more men or more women that are doing this in your practice?
It's 50-50. I mean, we have both. We have everyone you can imagine. I mean, I don't think that dental problems are for any particular person. It's very right down the middle.
Now, are married people, like one gets it done, then the other gets it done? Do they ever come together and do this?
It's funny. A lot of times I'll have women will send their husbands as a test subject.
Okay.
That's usually how it goes. And then if things go well, then they'll come and they'll refer their wives, and then the rest of their family. So usually the husband gets put out there first because of whatever reason. I have this one couple that comes to me. First, the husband came. We did a great job for him. We did everything under IV sedation, and he told his wife. And then his wife came. Now, they actually moved out of town, and they still come back to me just because we felt the relationship. So every time we see them, it's always good to see them. They come, and they stay for the day, and we do their work, and we do their cleanings and everything like that, and get them back on track. So people like this, they, the most important thing in their life, they're retired. So their lives, they go on cruises all the time. So when you're on cruises, what do?
You gotta eat.
You eat. That's all you do is eat all day long. So that's one of their favorite things to do. And for most people, social life is based around eating. You go out to see your friends, and for them, that was, something they talk about all the time. So
it's very nice, very nice. Now you brought some photos. What are we looking at?
All right. Oh yeah, okay. I got you here. So this guy, he's actually a friend now. He originally was a tattoo artist, so he kind of had a really kind of gruff personality when you first meet him, and partly because he didn't smile much. He seemed very serious, and that's a lot of patients when we first meet them. They're not as enthusiastic than after. But when he came in, he had been struggling a lot with these teeth that he had gotten at a different center. They weren't ever connected to the implants like they were supposed to be. And he just had some major problems that we were going to have to help him address. And once we got everything, fixed up and where they are, it's almost like his personality really came out. So
this guy could have been wearing a denture.
He was wearing dentures, yes. He was wearing dentures that were never connected to his implants because they had complications with it. Not sure exactly what happened there, but either way, we had to kind of start from scratch and get him back to where he needed to be. So in one afternoon, we basically placed all the implants. We 3D printed his new set of teeth, and we delivered them all in the same day. And
so he walks out with upper and lower teeth that don't come out.
Absolutely.
Okay. Yeah. That's a good-looking smile, by the way.
Yeah, he's the funny thing is when we first made his teeth, we made him a little yellower, and because he said he wanted something natural looking. And then we talked to him. We said, "Hey, man, you got a nice smile. You got a beautiful smile. Why don't we try to do him a little wider?" And we did that, and then he wanted a little wider. And the great thing about our technology is we can just remake a new set. It's really easy to do.
Those look pretty real.
Yeah, they are very
look like
natural.
veneers.
You would never know. I mean, the before and afters are so amazing. That's one of my favorite parts about that is they just look like they're his face. It fits his face. It's like it never was something else. They're very symmetrical and proportional, and they line up with the middle of his face. They follow the lip line. So there's a lot of different things that we look at when we're looking at these types of smiles. That make them look beautiful. So,
and this is all done by your in-house lab.
Absolutely. So I direct them in terms of what exactly we want to do in order to try to achieve the goal that the patients are doing. But yeah, that's what we do the day of the procedure. We're able to go and 3D design their teeth and what that looks like. We're able to use the 3D pictures of his face in order to make sure that the teeth line up with his nose and his eyes, and that the smile follows his lips.
For that guy.
Absolutely, yeah.
So this technology is like a face hunter or something you call it.
Right.
It's like scans their face, like
Right.
3D on a computer, and the patient gets to see what they're going to look like afterwards.
Yes.
Is that right?
Right. So we can make changes on the fly right there in front of you. You can say, well, that looks...
Do they say, I want that?
Absolutely. So we can show them pictures of teeth, and we can say, what kind of style do you want? Or you can bring me pictures of what... A lot of people bring me pictures of what they used to look like when they were younger. I want my teeth to look like when I was younger again. And we go by that, and we'll follow the same shapes and everything like that. We can actually smooth the teeth and change them digitally on the computer right in front of them.
And that guy looks way too young to be wearing a denture in the old days.
Anybody is too young to be wearing a denture. You know.
Okay, good point.
It's never a good thing.
Now we have to mention Medicare, Medicaid doesn't cover dental implants. Even the best dental insurance covers like a very small part.
Right.
So what's the answer?
Well, they should, but the reality is that a lot of our patients are able to finance it. We have financing experts at our office that help them fit it into a budget. You know, so
they're financing this. It's common.
Right. They want to know how much they can pay per month so that they can actually get it done. So, yeah, that's what the majority of people are doing.
And you're not carrying it yourself, right? So you have to have decent credit?
Yeah, exactly. Exactly. But it's getting better and better where they're able to help work with people to be able to make it happen.
Okay, good. And we're short on time, and I know you have another photo. What are we looking at?
All right, so this patient is one of the ones I like the most. She comes in and has a huge smile anyways. She is not someone that's scared to smile. There's a lot of people that don't like to smile when they have gum problems. But she loved her smile. She loved the fact that, you know, she's just a very happy person. And I got excited because I knew that with a full set of teeth, you know, that she would be even happier. We call these Whitney Houston teeth because it's literally ear to ear, very big, beautiful white teeth. And she had the perfect face for it. So her options were a denture, and there was no way she was going to do well with the denture. She wasn't going to be happy with that. We knew from right off the bat. So she was a great case for dental implants, and a great...
The after, she looks pretty happy.
She's super happy, and we love seeing her. She's one of our favorite patients.
So do you hear eating stories, like even from people like her, like saying, man, I could eat whatever?
Right, yeah. They tell us all the time that about the foods that they can eat. They can eat steak, they can eat salads, you know, which, believe it or not, it's difficult to eat without proper teeth coming together. So it definitely makes such a huge difference in just their day-to-day, you know, things you wouldn't think about.
Most of these people, they find you on the internet. I mean, because, you know, if you're Googled, I mean, you're everywhere, it seems like.
Right.
In Georgia. Is that how they find you? Like they know if I want to get new teeth, go to this guy?
We put a lot of stuff on the internet, but a lot of our patients are coming just word of mouth or referring from other people.
Nice.
So we're getting a lot of people that referred from someone else. So those are always great people. You know, anyone that wants to come in, we'll be glad to help them.
Do you meet them on the consult, typically?
Every time, yes. So, you know, we only schedule consults when I'm there, and I'm always, you know, there to ask questions, or if someone has questions for me, they can ask me whatever they want. But
now, you told me patients will go in, and even though they're in a dental office, they don't even want to show you their teeth. They say, Doc, this is probably the worst you've ever seen. Is that true? You hear that a lot?
I hear it every day.
Like, this is the worst I've ever seen. You've ever seen.
Yeah, and usually my answer is that if you have teeth, it's probably not the worst, because there's people that have already had their teeth
I guess they don't see them because they don't smile. These people don't smile with bad teeth.
Yeah, and I think there's something in people's heads where they maximize their issues to think that theirs is worse. The tragic hero symptom, you know, where basically they think that theirs is worse than everyone else's.
So you're kind of never too far gone to get this done?
Absolutely not.
Rarely. Okay.
No. I mean, it's very rare that we're not able to help them get somewhere.
People with bad teeth, you said, are judged. Can you elaborate on that? We got about a minute left.
Yeah, I think that it's unfortunate that people are judged for having bad teeth. I mean, you think about like the movies, you know, and the bad guy, you know, I think of the Captain Phillips, you know, I'm the captain now, you know, he's got those yellow teeth, you know, and it's terrifying. And it's just how we're psychologically...
Yeah, like the homeless person on a movie will always have bad teeth.
Right, or Bubba teeth, you know, for Halloween, you know. It's just psychologically how we're built to think about people. And sometimes it's unfair, but when we have someone that's had their teeth redone, our perspective of them changes. The perspective of themselves changes. They perceive themselves differently.
That's good.
But it's also socioeconomic symbol, you know, for a lot of people, you know, to have good teeth, you know.
You look more educated, more refined.
Right.
with nicer teeth.
Absolutely. Yeah. I mean, and people notice, and it affects you from a perspective of attractiveness. People
Because
are
she is
more
prettier with the new teeth.
Yeah.
And the guy that you showed me earlier is more handsome.
Absolutely.
I mean, teeth do, because I always think you guys are exaggerating. As a dentist, of course, he thinks a smile is important. But I guess it's a big deal, especially if you don't like it.
If you've ever been in a situation where you didn't have teeth, I mean, it's hard for us to understand the desperation that people get into when they can't eat, they can't chew. They go out to restaurants and they're not able to eat the foods that they want, or they avoid going out in social situations because they're afraid of what something might happen where their teeth might come out, or if they're in a restaurant and they get food stuck underneath their denture. It can be just very dramatic for some people emotionally, where they just don't want to be in this situation.
So when they get their teeth back, it's a big deal.
Absolutely, yeah. It can be. It literally is life changing.
I'll put you on the spot. Somebody watching this, they have no upper and lower teeth, or they have teeth that are literally ready to fall out.
Right.
But if everything works out, you have availability on your schedule, by the end of this week, they could have their upper and lower brand new teeth.
Absolutely.
That don't come out.
Right.
Is that right?
Exactly. Yeah, we could get them in. We do a full workup. Takes a couple hours, and then we ready to place the implants. We place the implants. We design their new teeth. We 3D print them in 45 minutes, and then we put them right in. The most expensive part is the dealing with the lifestyle changes afterwards, going out to eat more, going on cruises, and feeling more confident, being the person that you really want to be.
That's good. We're out of time. Final message. Somebody's watching this. They're the two groups. Bad teeth that are bleeding gums and the bad breath, like you mentioned, and they know one thing, they don't want a denture. And then the other group, which is the denture wearer. Let's say that they've heard what you had to say, but for whatever reason, they're still skeptical.
Right.
Or they want to put it off. What do you say to them?
Well, I think that the most important thing to know is that there is hope, that you're not alone, that there's many people that have been through this already. And we have tons of examples of that. And I think that it's important to trust and to give us a try. And if you do, I think you won't be disappointed.
So come in for a free consultation. Like, know your options.
There's no obligations to come in and for us just to look, and we'll take a free CT scan for you just to see. Okay. And you can figure out what your financial option, how much is it going to cost, fit into your budget, and then you can make a decision from that. So,
all right. I want to thank you so much for coming on the show.
My pleasure.
Good stuff. Good stuff. So if somebody wants to make an appointment, they can go online or just call your office?
Yeah, they can go on the website. There's an online scheduling function, or you can just call the office and someone can help you.
All right. Thanks again. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.